Hi, I'm Natasha, your Care Management Nursepreneur. Welcome back to the channel where we help nurses launch, lead, and grow care management businesses with purpose, professionalism, and impact. Today, we're talking about a powerful opportunity for nurses: remote patient monitoring, or RPM. It's changing how healthcare is delivered and creating new ways for nurses to step into leadership and deliver high quality care and even start their own businesses. What is remote patient monitoring? Well, remote patient monitoring, or RPM, is a service that lets providers track patients' health data from their home using connected devices. Think blood pressure cuffs, glucometers, pulse oximeters, thermometers, scales, and all of these, plus other devices, they're able to send real-time health data to a care team without the patient needing to visit the clinic. So, for example, we have Miss Thomas, who is a 72-year-old patient with diabetes and high blood pressure. She gets an RPM kit with a blood pressure cuff and a glucometer. She checks her vital signs daily, and one day the system flags a high blood pressure reading. Her nurse care manager is alerted and calls to check in on Miss Thomas, finds out that she ran out of her medication and she hadn't refilled her prescription. The nurse care manager is then able to work with the pharmacy and the provider to get Miss Thomas back on track. That is RPM in action, actually catching problems early and avoiding a crisis. Why does RPM matter now? Let's be honest. Patients don't want to keep running back to the doctor. They don't want to be back and forth to the doctor. And providers, they are stretched thin by the amount of patients that they have to see. So RPM solves that problem by bringing care into the home and detecting issues early while supporting patients between doctors' visits and creating a revenue stream for the practice, as well as opening up new roles for nurses to lead and provide this care remotely. So it's a win win for everyone. The nurse's role in RPM is to provide the care management while the physician bills for RPM. Nurses are often going to be the ones that are delivering the service. So here's what that looks like. So the nurse is monitoring the incoming data and calling the patients when the readings are off and asking questions like, did you take your medication? How has your salt intake been? What have you been eating? Have you been feeling stressed? We provide education to the patient and then also develop next steps, and then also determine when we need to escalate to the provider for something that's critical. And another thing that we do is really document that care that we provide as care managers. Let's look at Mr. Grand. He's had a 4-pound weight gain in 2 days. He has heart failure. So the nurse is alerted and calls to learn that he skipped his diuretic medication because he's been going to the bathroom too much at night. So just that one phone call with the nurse care manager could have prevented an emergency room visit. So this is where nurses shine. We don't just read numbers, we act on those numbers with clinical judgment and compassion to help those patients. So, what does the workflow look like for RPM? So, a simple workflow for RPM would be the provider enrolls the patient receives the devices, you or your RPM partner shows the patient how to use that, and you review the data each week, you reach out, you educate, and you track the time. At the end of the month, the provider bills for the RPM and the care management service, and that's it. You repeat it monthly, and it's billable, it's scalable, and it's actual meaningful work. So, how can nurses start an RPM business? So, there are a couple of options. So, we'll just talk about two. One, you can contract with a provider and you deliver the RPM to doctor bills, and then you get paid for your time. Or you can launch your own RPM agency and you manage the RPM for multiple providers and partner with a tech company for the devices. And this way you are able to build your business around the care coordination and the data review for the RPM. What are some of the skills you need? If you're a nurse, you're already qualified. You have the clinical judgment, you know how to provide patient education, our critical thinking skills, and our documentation and communication skills as well also equip us with the tools we need to be care management. And then, of course, basic technology confidence. You don't need another degree. You don't need to go back to school to get a certification. You just need a plan and a system. And that's what I teach. Why nurses are perfect for RPM, because it's not just about the technology, it's about that touch, it's about that caring. We don't just say your blood pressure is high. We say, let's figure out why and how can we fix that together. That's the level of support that patients need. And nurses are uniquely equipped to provide that. So if you're ready to start, RPM is growing and nurses need to be at the center of it. You can you can wait for someone to hand you a role in RPM, or you can create the role yourself. So if you're ready to lead, join my care management mentorship program. I'll show you how to launch RPM and CCM services, partner with providers, and build a care-focused business that truly makes a difference. So like, share, and subscribe for more content like this. We're transforming healthcare one nurse, one patient, and one data point at a time. Thank you so much for joining me today.